Welcome to this video in which we're going to be discussing can atlas-based auto-segmentation ever be perfect? Insights from extreme value theory, a paper by first author Bas Schipaanboord. To understand this paper, first we need to take a look at atlas-based auto-segmentation to understand the context of the paper. So in atlas segmentation, we have a patient image, normally a CT, which we want to outline the organs at risk for radiotherapy treatment planning. And one approach to doing this is to use an atlas. An atlas is a previous patient image with the contours that have already been drawn on it. So this combination of an image plus the contours is what we refer to as an atlas. Using deformable image registration, we can register the atlas image to the patient image and use that registration field to warp the contours from the atlas onto the patient. Atlas contouring is very sensitive to the quality of the registration, but also to the choice of atlas. Registration typically performs best where there's a low amount of deformation to be performed. So if we can find an atlas which is very similar to our patient and we don't have to deform the image as much, we should expect a better contouring result. Consequently, it's been proposed that if we take a lot of atlases and we can select the atlas or atlases that are most similar to the patient, we should get better performance. And in clinical practice, a lot of commercial systems, typically users would use 20 or maybe up to 50 atlases within that database. And the authors of this paper asked the question, well, what happens if we take that to the extreme? What if we say create a database of 5,000 patients? Maybe a large cancer center could treat 500 patients of one type in a year. That would represent 10 years of data. That's a very big database, 5,000 patients. If we use those 5,000 patients as an atlas database, what performance can we get to? And to do this, they use a statistical technique called extreme value theory. Extreme value theory you may have come across in the context of weather, where people talk about once in 100-year rainfall. Well, how do you know what once in 100-year rainfall looks like? Here's an example from Oxford from about a decade ago, where we experienced an extreme weather event. There was a lot of rainfall in 1 month, and all the major roads into the city centre flooded. So how do we estimate this? So if we take the monthly rainfall over the past, in this case 150 years or so for Oxford, the normal rainfall will follow some statistical distribution over time. I don't know what it is, but let's pretend it's Gaussian. Those extreme weather events, however, don't tend to fit within the tail of that distribution. They represent a different statistical distribution. So to model this with extreme value theory, there's a technique called points over threshold, where we define a threshold at which we start to consider an event heading towards extreme. And we can extract only those events and throw away the ones that fit within the standard distribution of rainfall. Extreme events typically follow a generalized Pareto distribution. So we can take these extreme events and then we fit the Pareto distribution to them, and we can estimate the probability density for those events. Now we can start to look at what once in 100-year rainfall looks like based on the probability density. What is our expected once in 100-year rainfall? And for Oxford this turns out to be about 190 millimetres per month. So how did the authors apply this in the context of atlas contouring and radiotherapy? Well, they took a database of atlases. In fact, for this paper they took two databases, one for head and neck and one for thoracic imaging. Both of these databases had about 300 atlases in, so 300 images with their associated contours. Taking each atlas in turn and treating it as a patient, they performed a registration to all the other atlases But because our patient also has a contour in this case, we can measure performance. So then we end up with a matrix of the performance for every atlas against every other atlas. And we ignore the diagonal. There's no point registering a patient to itself. Now, if we had a symmetric registration, we might expect the upper triangle to be symmetric with the lower triangle. If we don't have a symmetric registration, we may find slight differences. From these results, again, we can now apply the threshold, and we can look at the extreme or the high values within that data and extract them out and apply the points over threshold method from extreme value theory. So what did they find? Well, as I said, the databases consisted of about 300 atlases. That represents about 100,000 combinations or 100,000 results from which we can extract the extreme values. And the results they show in the paper, unfortunately only in tabular form, show that the predicted expected performance for once in 5,000 atlases, i.e. if we had a database of 5,000 atlases, what would we expect, was typically in the range of sort of 0.9 upwards. There's a few where they score slightly lower, but it was essentially a dice score of 0.9 or higher. They also compared it to the best performance they'd seen in those 100,000 registrations, those 100,000 atlas-based contourings, and actually the expected result was fairly similar to the maximum they saw in those 100,000 registrations. So what do we learn from this paper? What does this tell us about atlas contouring? This paper's got quite an interesting discussion around inter-observer variability and how this particular experiment effectively ignores inter-observer variability by looking at the result of atlas contouring in a way independent of the image. If the registration is wrong but the contour is wrong and it results in a better result, we still see that better result within our extreme values. It tends to suggest, therefore, that if we could build a large database, we can see improvement. So I think it gives some encouragement to say that actually there is potential still for atlas-based contouring, but it leaves many questions unanswered. Let's now talk to Bas about his opinions on the paper, reflecting on it after a couple of years.
Hi Bas, good to see you again. When we worked on this paper together, you were working for us at Murata. Since then you've moved on to do a PhD, so tell us about where you are and what you're working on.
Hi Mark, good to see you again as well. So I started a PhD at the radiotherapy department in Rotterdam at the Erasmus Medical Hospital. And I'm working in automated treatment planning for robotic radiotherapy. And specifically that's for a machine called the CyberKnife. Well, this machine, it basically has a treatment device mounted on top of the robotic arm. This allows for more degrees of freedom, so better treatment possibilities, but also makes the treatment planning much more complex. So my task in this whole procedure is to make the treatment planning more effective and more efficient. So for shorter treatment delivery times, but also for shorter treatment planning times. And this all to improve the tumor control and to reduce side effects of the treatment.
Great. So still working in radiotherapy, not so much focused on the auto-contouring anymore, but still helping to improve patient treatment.
Yeah.
Great. So let's have a discussion about the extreme value theory paper. What did you find most interesting, exciting, surprising perhaps about working on this paper?
Yeah, so one of the aspects I really liked about this paper is that it's different than what you normally expect from a paper in the literature. So what you often see is that, okay, we have two treatments and we want to compare the two, we design a study around it, we do the experiments, and then we compare the treatments, and you find one better than the other.
Yeah.
And in this paper, we really want to estimate what we could do in a hypothetical situation of 5,000 atlases. So what we could do in the future.
So we're trying to predict the future.
Kind of. Not really predicting the future, but yeah, we want to look have a glimpse in the future.
See what we might expect, really.
Exactly.
And what do you think this paper tells us about the future for atlas-based auto-contouring?
Yeah, so improvement in auto-contouring is, of course, depending on several aspects. One of the key aspects in the atlas-based auto-contouring is that the bigger the atlas, the higher the likelihood is that you find a good match for the patient. So increasing the database would result in a better match. But one of the aspects that extreme value theory does not include is that, for example, a different technological improvement like deep learning could also improve the auto-contouring. So it estimates the expected performance based on the current technological status.
But if we grow the database size, we should expect atlas contouring to be good. So in that sense, there's still potential for atlas contouring in an era of big data.
Yeah, because we observed that for an atlas database of 5,000 atlases, we saw a performance similar to inter-observer variability. So we could get as good as if you asked two physicians to delineate the same structure.
In that sense, we're trying to find the person's twin, essentially, to select the most similar person to the atlas. Oh no, sorry, to the patient. So have you ever seen, wandering around the Netherlands, your long lost twin?
No, I don't think so. I don't think I have ever met my long lost twin. And I think I've also seen more than 5,000 people in my life. So in that perspective, you probably need a bigger database than 5,000 atlases.
So a really huge database in the end, potentially.
Yeah,
and
I think so.
That's only considering the outside and somebody's face, not even looking at their internal anatomy. So
yeah, and the outside stays relatively the same, and the inside there are daily variations as well.
Yeah. So then we're trying to look at changes over time as well as how similar somebody is. In this particular study, is there anything else you would have liked to have tried, investigated?
So one of the tricky parts of this this study is that you try to estimate something for a hypothetical case. Hypothetical case of 5,000 atlases, and the tricky part of this is how do you validate what we estimated is actually right. So that's a really tricky part. So that was one thing I would like to have done, but how do you do that? Basically by gathering 5,000 atlases, and that's almost undoable for such a case.
I guess we maybe could have validated it for a smaller data set in terms of just 1,000 atlases perhaps, and check that our predictions hold that far out. But yeah, the further out we extrapolate, the harder it is to know how accurate our prediction is.
Yeah. So that's one thing that you could check. So if the extreme value theory is that you could use that in this kind of settings. But another thing what also would have been interesting is that for this case we assume perfect atlas selection, and in the clinic that's normally not what you get. It's very hard to select exactly the perfect atlas from this database. So another interesting topic would have been, what is the estimated performance for clinically achievable atlas selection method.
Or yeah, for a particular atlas selection type. Although,
Exactly.
as you pointed out earlier, if you change the technology, then your predictions no longer hold. So, but
Yeah.
it would have been an interesting thing to delve deeper into. I guess had the processing time not taken, the best part of several months.
Yeah. Yeah, over 1,000 experiments was this already, so it took some computers quite some.
I think 100,000 registrations or so.
100,000, yeah, sorry.
So why should somebody go and read this paper?
Yeah, like I said, it's different than the usual kind of paper. So I think that's an interesting part.
Yeah, it gives us a different perspective. Maybe will spark some ideas for people.
Yeah.
All right, thanks for taking your time out your day to talk to me. Really good to catch up with you, and good luck with the rest of your PhD.
Yes, you're welcome. Thanks.
So, if we take that question at the start of the paper, can atlas-based contouring ever be perfect? I think this paper has illustrated that potentially it could be. If we can build a big enough database, we could get to a level of performance where the auto-contouring result is near perfect. But it would require two things. First, it requires a very, very large database. And secondly, it requires a way to select atlas. We're going to look at that question of atlas selection in a future video. But the question remains, is it worth the effort to build such a large database? As Bas highlighted himself, finding that person's long-lost twin is going to be the challenge. How many people would we need to get to that level of perfection? Thanks for listening. I hope you join me again soon for another paper review.